Well, it's heartbreaking.
The Manitoba government is firmly against the introduction of safe injection sites and instead is committed to a recovery-oriented system of care and further investments into treatment. The government rejected the idea of a safe consumption site after Community Wellness Minister Sarah Guimard toured Vancouver's downtown east side with Alberta Public Safety Minister Mike Ellis this week. The Vancouver neighborhood is home to several tent encampments and supervised injection sites. In a statement, Guimard says she believes providing funding for treatment and long-term recovery is the best path for the province. Quote, "Our government is dedicated to the support of a continuum of care, including prevention, early intervention, including harm reduction, treatment, and long-term recovery for individuals affected by substance use and addictions."
Minister Guillemard's decision to exploit the homelessness crisis in Vancouver for her political decision is wrong.
Thomas Linner, provincial director of the Manitoba Health Coalition, says consumption sites are part of the continued care and addictions treatment and recovery, and says the government's different approach is a disservice to drug users.
That's a real shame for the families of people who are suffering from addiction, for the communities that are in crisis right now, and I would really urge the minister and the premier to change their mind on this.
In 2019, there were 199 fatal overdoses in Manitoba. That number skyrocketed to 372 in 2020, and that number continues to increase as 2021 saw 407 total deaths. Marion Willis from St. Boniface StreetLink says in a well-developed recovery and harm reduction environment, safe injection sites would save lives. But due to a lack of staffing in the healthcare system, it wouldn't be effective at this time.
Where are we finding the doctors to run a safe injection site? Where are we finding the nurses? We have a hard time finding enough nurses to work shifts in our hospitals.
Willis says there really isn't a plan right now to fix the homelessness and drug crisis, which continues to get worse. She says provincial officials and community groups like St. Boniface StreetLinks all need to come to the table and find solutions as soon as possible.
We need to be going directly to people who are using substances and asking them what harm reduction looks like for them. And on the topic of safe injection sites, asking the using population if they would actually use them.
Linner says more lives could be saved if safe injection sites were operational province-wide.
So many families and so many communities know the pain of addiction, know the pain of losing a loved one to addiction. We are fighting to change that and to reduce the toll of death on our streets.
In Winnipeg, Alex Karpa, City News.